With breastfeeding, it should not be painful. If it is, usually the most common cause is that baby's not latched correctly or does not have enough breast in their mouth, and what causes that is the tongue will end up pinching mom's nipple, which will be causing pain. There are different positions that mom can lie in or sit in order to breastfeed, and there are pictures of those on page 643 in your textbook. How do we know that breastfeeding is going well? We need to evaluate it. That's the other part of our job as a nurse. So mothers will report that they feel a firm tugging sensation, not pain, tugging on her nipple. There's no pinching, no pain. Baby sucks, and when the baby sucks, the cheeks are rounded. There's no dimpling in the cheeks. Baby's jaw glides smoothing with sucking. And number 4, swallowing is usually audible. Just so that you know, as another teaching point with breastfeeding, the sucking actually creates a vacuum type seal. So in order to prevent nipple trauma, we need to teach the mom how to break the seal. In order to do that, she will insert a finger into the side of baby's mouth between the gums and leaving it there until the nipple is completely out of the mouth. As nurses, we should observe at least one breastfeeding per shift to make sure everything is going correctly. In order to document the information that we find, you can use something called the latch assessment tool. The letters stand for L, latch. A is audible swallowing. T is the type of mom's nipple. And C is comfort level of mother. And H is the hold. What position is she holding the baby in? The other thing we're going to talk about is the letdown reflex, or how does mom know that her milk has come in, as you will hear them call it. The mother will feel a tingling sensation in the nipple and then the breast. The baby suck changes from a quick swallow suck to a slower suck. You will hear audible swallowing. In the early days, the mother usually feels uterine cramping, and she'll have an increase in her lochia during and after feedings. And the mother will feel relaxed or drowsy during feedings. We need to talk about the frequency of feedings. For breastfeeding, it should be 8 to 12 times in a 24-hour period. Sometimes babies will do what they call cluster feeding, and they'll breastfeed every hour. Then what can happen is, if the baby is sleeping, you can let them sleep a little longer for 3 to 4 hours between the cluster feedings. Parents do need to understand that they do need to awaken their baby in order to feed them at least every 3 hours during the day and every 4 hours at night. The infant is feeding well if they are gaining adequate weight. There is something called demand feeding, and then usually what demand feeding is where the infant is actually determining the frequency of the feedings. With demand feedings, the infant should still receive at least 8 feedings in a 24-hour period. We talked in chapter, I believe, 23, that it is common for newborns to lose weight in the first few days before they go home. They typically lose about 5 to 6% of their body weight after birth, and then they will begin to gain it back. If we do have a newborn and mom is solely breastfeeding, that means no supplements, just completely breastfeeding, and the baby is not gaining weight or it's a slow weight gain, she can always add 1 to 2 feedings in a 24-hour period, and this will help. With preterm infants, just kind of a side note, human milk is ideal for preterm infants. It actually enhances retinal maturity in the preterm infant and improves neurocognitive outcomes. It also will decrease the risk of neck, which we will talk about in chapter 25. What you're looking at is an example of some breast shields, or nipple shields as they will call it. This is a few tools that can be used in order to help mom, if she has an inverted nipple, to draw the nipple out to help baby have something to latch onto. The other thing we need to talk about is mechanical pumps. Moms can also pump milk from their breast, and for the most part, by the time they go home, they will need to pump their breast because they will become engorged, and that just means that their milk comes in and both breasts are completely full, so they need to make sure that they are emptied. There are different types of breast pumps that are out that you can buy. I'm not going to test you on the different types of breast pumps. The one thing you do need to look over and be aware of, because it is something that is educational and that will tend to pop up on boards, is the actual storage of breast milk. And the guidelines for that are on page 650 in the patient teaching box.